Hello, my dear friends. This is Dr. Charles from PHI Preventive Health Institute, where we share practical lessons drawn from real cases we see every day. Behind every wound is a real story. And today's topic, delayed wound healing, is something we encounter more often than many people realize. That is why our team looks at it from 4 perspectives: what the doctor sees, what the nurse manages, what the pharmacist safeguards, and how the dietitian supports recovery. Each piece stands on its own, but together they reveal the bigger picture. Be sure to explore the rest of the series. Now, let's look at this from the pharmacist's perspective. In real life, wounds rarely become complicated overnight. It usually starts small: a cut, a sore, a small ulcer on the foot or leg. At first, it seems manageable. The wound is cleaned, a dressing is applied, medication is started, and improvement is expected. But when healing slows down, a different pattern begins. Missed doses, stopping treatment early, changing medications without guidance, discontinuing therapy once the wound looks slightly better. And that is where the problem starts. Because wound healing is not only about covering the skin. It depends on infection control, circulation, and consistent medication use. So the pattern often looks like this. Antibiotics are started, symptoms improve slightly, treatment is stopped early. Infection persists beneath the surface, healing slows or reverses, not because the medicine failed, but because the course was not completed. Now consider another important factor. Many patients with chronic wounds also have high blood pressure, and this plays a major role in healing because blood pressure directly affects circulation, and circulation determines how oxygen and nutrients reach the wound. When blood pressure is uncontrolled, healing becomes slower and less efficient. At this stage, multiple medications are often involved: antibiotics, blood pressure medications, and pain medications. Individually, these treatments are appropriate, but together they require consistency. Stopping early can allow bacteria to survive, increase the risk of resistance, cause infection to return or worsen, and when infection persists beneath the surface, healing is delayed. At the same time, blood pressure medications are often misunderstood. Some patients stop them when they feel normal. Others take them irregularly. But blood pressure treatment is not symptom-based. It works silently in the background to protect blood vessels and maintain steady circulation. Without that stability, wound healing becomes more difficult, not because the medicines are ineffective, but because the treatment system is inconsistent. Then side effects begin to appear: dizziness, fatigue, stomach discomfort. So the first step is clarity. What is each medication for? They are not interchangeable, and they must be used consistently. Then comes structure. Take antibiotics exactly as prescribed. Complete the full course, even if the wound appears better. Take blood pressure medication daily without interruption. Report side effects early instead of stopping treatment on your own, because incomplete treatment disrupts healing. Now step back and look at the full picture. Everything is connected, and when one part becomes inconsistent, healing slows. But when properly managed, the outcome improves. Better infection control and improved wound healing. Wound care is not only about dressings, and treatment is not only about starting medication. It is about consistency, long enough for healing to actually happen. So do not stop treatment early because symptoms improve temporarily. Understand the process, follow the plan, and review it when needed. When to act. If you have a wound that is not healing, are using antibiotics or blood pressure medications inconsistently, or notice worsening pain, swelling, or discharge, do not ignore it. Speak to your pharmacist or healthcare provider for proper review, or call or WhatsApp. Plus 233 2087 20347. And remember to explore the other 3 perspectives because each one completes the picture.